Alright, I'm Josh. I'm about to do a complete assessment. I'm going to do it on this fine gentleman here in front of me. Alright, excuse me, sir, mate. Can you can you tell me your name or your initials?
BSK.
Alright, what's your date of birth?
9/12/92.
How old are you?
21.
Do you know where you are right now?
The nursing building.
That is correct. Alright, I'm going to assess your skin color real quick. It's all tan and consistent. It's congruent with your genetic background. Let's see. He appears to be in good nutrition. Do you have problems with eating, or do you feel like you eat enough?
I eat enough.
Okay. His posture it's a little slouchy. I'd sit up straight, sir. But there's no obvious physical deformities. Let's see. Can you stand up for me real quick, sir? Yeah, he appears to have full range of motion. You can sit back down. All right. His facial expression is appropriate for the situation. He appears comfortable, and for the most part, he's being cooperative. Let's see. All right, repeat after me, sir. My favorite person in the world is Joshua Condado.
My favorite person in the world is Joshua Condado.
All right, his speech is very clear and fluent. He does not have any hearing deficits. He appears to be hearing me fine. He appears very clean. He has very good hygiene. His clothing is appropriate for the situation. All right, I'm going to assess your skin again. It still appears to be nice and consistent and tan. His capillary refill is less than 2 seconds. There's no obvious clubbing. It's very warm to the touch. His skin doesn't have any lesions. No signs of dehydration. His turgor is elastic. All right. The hair on his scalp is brown. It's very nice. He's normocephalic. His head is proportional to the rest of his body. It's round. There's no deformities on his cranium. Does it hurt for me to palpate your head at all? No pain at all. Okay. All right. Can you scrunch your face for me? Make a frowny face, and now smile really big. Can you stick out your tongue? Move it back and forth. All right. His face is symmetrical. It's palpable and smooth. No pain upon palpation. All right. Feel your joint here. Open and close your mouth. One more time. It's smooth and even. Is there any pain when you do that?
No.
No. Okay. Feel your temporal pulse. It's about a +2. Is there any pain on the palpation there? Okay. Is it tender up here above your eyebrows?
No.
No. Any tenderness on your muscle or your bone or muscle down here?
No.
No pain at all. Okay. I'm going to get this card here, and I'm going to have you, about 14 inches. Read this line here.
428739 EWM00X31 plus.
Read it again. No, I'm just kidding. That was very good. You have 20/20 vision. All right, cover your left eye. All right, follow my finger. Very good. Can you look straight at me? Can you see this over here?
Mm-hmm.
Tell me when it starts to actually back up a little bit. Okay. Tell me when it's moving.
Moving.
Okay. Now cover your right eye. Follow my finger. Very good. Tell me when it's moving. Look straight at me. Tell me when it's moving.
Moving.
Okay. Very good. I'm gonna get a light really quick. Okay. Look straight at me. Okay. All right. Your eyes are equal and reactive. Alright, look straight at me. Look straight at me. I'm gonna put on this. Okay. Their blood vessels are visible. There's no pinkness or redness or swelling. They're clear and glossy. No lesions noted. Your sclera is white. No blood vessels. Very, very good. It's white and consistent throughout. I'm gonna need this light again. Just light again. Okay. Okay. I'm gonna just look at your eyes again. Look at me. Okay. Smooth and clear. Your iris is round and flat. Your eye colors are equal and green. Okay, look straight ahead. Alright, yeah, you definitely have perla. They're about 3 millimeters. Okay, I'm gonna dim the lights for this procedure real quick. Lights. Okay. You open wide. Alright, the red reflex is present. Vessels are present and seen. The retinal background is pink in color. Lights, please. Cute. Okay, his ears seems to be symmetrical, even to each other. No redness or swelling. Is it painful when I touch your ears at all?
No.
No. Okay, I'm gonna need this thing. Okay, I'm gonna pull his ears up and back. Alright, his tympanic membrane is present. It's grayish in color, intact, no lesions noted. Do the same thing on this side. Tympanic membrane is present. It's grayish in color, shiny, intact, no redness or swelling, no lesions noted. Alright. Repeat after me. I am awesome.
I am awesome.
Okay. Repeat it again. I am awesome.
Awesome.
Okay. Alright. Good job. I just was assessing your cranial nerve 8. Alright, your nose. I'm going to assess your nose now. Does this hurt at all for me to touch it?
No.
No? Okay. It's symmetric. Very symmetric. No deformities, no inflammation, no lesions noted. Okay. Breathe in and out. Alright. Again. Okay, seems to be good patency. I'm going to look inside your nose. Okay, I'm looking inside your nose. Tilt your head back, sir. Very hairy. No lesions. Very symmetric. No deviation in the septum. Pink and moist. Alright, his lips appear to be smooth and not cracked at all. Open your mouth, sir. Your buccal mucosa is pink. Where's this light? Again, open up. Buccal mucosa is pink. The tongue is also pink. There's saliva present, no lesions present. Alright, can you clench your teeth for me? Teeth are straight, intact, no chips or caries noted. Say ah.
Ah.
Okay. Smile for me really big. Gums are tight with margins. Okay. Okay, I'm going to have you open your mouth again, stick your tongue out. Can you push your tongue against this? Okay. Assessing cranial nerve 12 there. Okay, I'm going to stick this back in your throat a little bit. Oh, please. That scared me. His gag reflex is intact. Cranial nerve 9 and 10. Say ah.
Ah.
uvula is midline and hanging. Tonsils are barely visible at about a +1. The anterior palate is irregular. Transverse posterior palate is pink and moves upward. Alright, his neck appears to be symmetrical and aligned with the body. His muscles appear symmetrical with no lesions. Does it hurt for me to palpate your neck at all?
No.
No. Okay, the skin color is consistent with the rest of his body and with his genetic background. Alright, now I'm going to assess for any cervical lymph nodes or anything. Feel a little jugulo-digastric here, just barely palpable. Raise your arm for me, sir. I'm going to feel under your shirt. Any down here. Alright, there's some over here. Okay. Alright, I'm going to check your carotid pulse over here, just one side at a time. Don't need anybody passing out. Yeah, it's pretty bounding. I'd say about a +3. I'm going to listen to him real quick, see if I can hear any breathe. Definitely hear it on that side. Definitely hear it again on that side. Take a deep breath, sir.
You can hear him breathing.
I can hear your breath through your trachea.
I'm gonna die soon.
Assessing your trachea, it's midline and symmetrical, no deviation. I'm gonna check for your cranial nerve 11 real quick. All right, can you shrug your shoulders? I'll just put against my hands. Okay, good. Move your head up and down. Okay, with a little resistance. Up and down. Okay, now can you move it side to side? How about this way? Okay, now with a little resistance, same thing. Okay, all right, that's intact. Strength is even bilaterally. So I'm gonna check your thyroid. Any problems with your thyroid that you know of? No enlargement or anything. All right. Take a big gulp for me. Okay. So I'm gonna assess your back. Your back is it's warm and dry. Color is even with the rest of your body, nice and tan. Skin is smooth, firm with texture. Your spine is midline. Spine is midline. Take a deep breath for me. One more time. There's symmetrical expansion. I'd say his anterior to posterior diameter is about 2 to 1. Let's see. All right. So your skin on your chest. Take a look at down your chest. It's smooth and firm, no lesions. It's warm. The color is even. It's consistent with the rest of his genetic background and skin color. Okay, I'm gonna take a listen to your respirations real quick. Okay, take some deep breaths for me, sir. Okay, do you mind if I listen to your lungs on your back?
Nope.
I'm gonna lift your shirt up to auscultate. All right, deep breath. Deep breath. One more. Again. One more. One more. Okay, they're all bilaterally clear. He's breathing about 16 breaths per minute. Let's see. Okay, say 99.
99.
Say 99.
99.
Say 99.
99.
One more time.
99.
One more time again.
99.
One more time again.
99.
One more time.
99.
Okay, vibrations felt all over. They're all palpable and symmetrical. I'm gonna percuss your lung fields here. Okay. All right. Vibrations were felt and equal and bilateral. Resonant sounds in all of your lung fields. They're clear and low pitch. I'm going to listen one more time real quick. Some deep breaths. Okay. See, is there any tenderness down here?
No.
No. How about around here on the side? Any tenderness?
No.
No tenderness at all? Okay. Good. No tenderness around his rib cage. See, breathe in and out, or hold. Take a deep breath and hold it. Okay. Release. One more deep breath. Hold it. Okay. Release. One more deep breath and hold. Okay. Release. All right. Now I'm going to do some range of motion exercises. If you'd stand up real quick. I'm going to put your hands forward. Now behind your back. Put your arms above your head. Now to reach behind and yeah. Okay. Now bring your arms out in front of you. I'm gonna put some resistance on them. Try to lift up on them. Okay, now push down on him. He's a very strong and very good range of motion. Let's see. I'm gonna feel for any epitracheal nodes. Any tenderness on palpation? Okay, they're not palpable. I don't feel them anyway. All right, I'm gonna palpate above your AC area. Okay, I'm going to now assess brain VSK laying down on this table. I'm gonna check for any jugular venous pulse. I don't feel anything. Can you sit up just a tad for me, sir? About 30 degrees.
Is there a pillow or something?
No. Okay. Okay. That'll do. That'll do big. I don't see any pulsations or anything. No jugular vein distension or anything. Okay, you can lay back down. I'm gonna assess for a precordium pulse. Don't mind me. I don't see anything. There's no precordium pulse, no heaving. I'm going to now assess your heart, and auscultate. First, I'm going to listen for the aortic. Okay, and I'm going to go over to the pulmonic valve. Tricuspid. The mitral. Alright, no murmurs present. I hear S1 and S2 sounds, no S3 or S4 noted. I'm going to assess the apical pulse for 1 minute. it was 72. Now going to assess for your apical impulse. Let's see. Okay. So 1 by 2 centimeters. Now I'm going to assess your abdomen. Do you mind if I lift up your shirt?
Go ahead.
Yes, sir. Okay. First of all, do you need to use the restroom or anything?
Yep.
Yeah. Well,
No.
I would. Okay. Let's see. The skin is consistent. No lesions noted. It's all intact. Appears to be consistent with the rest of their skin. It's warm and dry to the touch. The umbilicus appears to be midline. There's no visible lesions or anything. Contour is round and smooth. I'm going to also take your abdomen now. We have active bowel sounds through all 4 quadrants. There's no vascular sounds or bruits noted upon auscultation. I'm going to percuss your abdomen. Okay, there's tympany noted in all quadrants. I'm going to now lightly palpate your abdomen. There's no rigidity. Next, we'll do some deep palpations. Is there any tenderness when I push down like this?
No.
Okay, there's no masses noted. Next, I'm going to palpate for the liver. All right, taking a deep breath. And breathe out. Okay, liver is not palpable. Next, I'm going to palpate for your spleen. It is not palpable. Kidneys are not palpable. The aorta is not palpable. I'm just going to now I'm going to assess your lower extremities. Would you scoot up on the table just for me and just a little bit real quick? Okay, that's good. Alright, legs appear to be symmetrical. Alright, warm is dry, and the skin is warm and dry. Alright, I'm going to take off your shoes real quick. On both of your feet, I'm going to take off your shoes bilaterally. Alright, let's see. Your cap refill is less than 2 seconds. Hair is evenly distributed. Alright, I'm going to palpate for some pulses here. Popliteal. About a +2 bilaterally. I'm going to feel for your posterior tibial. About a +2 dorsalis pedis. About a +2 bilaterally. No edema or bunions. Skin color is consistent with the rest of his body. I'm going to move to your fingers real quick. Can you touch each finger to the tip of your thumb? Okay. See, can you flex your knees? Lift up on both of your knees. Okay. Can you lift your leg up and move around your ankle? Appears to have full range of motion. Let's try it on this leg over here. Okay. You relax your legs. Now I'm going to touch or assess sensation around your face. Alright, do you tell me when I'm touching you? Close your eyes and tell me when I'm touching you here.
When? Cold. When? Cold. Cold.
Okay. Moving down to your arms. Same thing.
Cold. 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 Cold.
Okay, moving down to your legs. Tell me when I'm touching you.
Yes. 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 Yes.
Okay. Now, can you tell me which side of the face I'm touching?
Right.
I'm trying to really
Left.
touch your feet with this. Okay. Can you? I'm gonna put something in your hands. Can you identify what it is? With your eyes closed.
Fork.
Yes, it is a fork, sir. Okay. Okay, I'm gonna have you open your eyes, touch my finger, and touch your nose. Touch my finger,
Am I having a
your
stroke?
nose, finger, nose. Now the other hand. Finger, nose, nose, finger, nose, finger. Okay, now I'm gonna have you rub this. Yeah, yeah, but I want to make sure. Okay, it appears to be good. Your cerebellar function is good. It's on point. Now I'm going to assess some of your deep tendon reflexes, starting with your bicep. Alrighty. Other side over here. About a +2 bilaterally. Now I'm going to assess your brachioradialis. So I'm going to put the +2 bilaterally. I'm going to assess your tricep. It's about a +2 bilaterally. Now I'm going to go to your patellar. +2 bilaterally. And now I'm going to go to your Achilles. About a +2 bilaterally. Now I'm going to assess for a vacancy. Shouldn't be one. Okay, they're absent. All right, and I'm going to assess some of your muscles and your bone structure. Can you get up for me and walk across the room to that wall and back for me, sir? Seems to have full range of motion. Now can you walk on your heels? There and back. I'm just kidding. Okay, now on your toes. Okay. All right, now come over here and stand with your eyes closed. Stand with your eyes closed. Close your eyes. Okay. Just assessing the Romberg sign there. Now, with your eyes closed, can you bend one of your knees? Now the other one. Okay. Now, can you touch your toes? Can you bend over and touch your toes? Okay. Can you rotate your spine side to side in a circular motion? Now, can you let's see. Now, can you bend down like this, side to side? Enough, back and forward. Okay, his spine appears to have complete range of motion. All right, thank you, sir. You appear to be healthy. The end.